Πιο δυνατά.
Κύριε Καστανά, με ακούτε?
Βεβαίως, τώρα σε ακούω πολύ καλά.
Λοιπόν, με ξέρετε και σας ξέρω. Λοιπόν, ήθελα να ρωτήσω τον γιατρό σας.
Ναι.
Πριν 4 χρόνια πήγα και έκανα ένα τεστ. Είμαι 74χρονο.
Μάλιστα.
Και μου είπαν να παίρνω Flomax. Να παίρνω τα Flomax 8 χρόνια. Ένα την ημέρα.
Μάλιστα.
Γιατί άμα δεν το πάρω αυτά, δεν μπορώ να ουρήσω. Λοιπόν, πρέπει να το συνεχίσω ή να ξαναπάω για τεστ.
So he's 74 years old.
4 years ago.
Yeah, they gave him Flomax, 1 tablet a day to take to help him with his urinary problems. And his question is, should he continue doing that now?
Well, it all depends on the kind of symptoms that he has. Flomax is usually used for an enlarged prostate. The nature of the medication, just so you know, it's a blood pressure medication, but the side effect of it is that it opens up the urinary system so they can urinate much better. If you take Flomax, you always want to take it at nighttime, so in case you get tired or your blood pressure comes down, you're not driving and you're not working. So it's recommended to take it before you go to sleep. If the symptoms are, if he's doing well from the symptoms, he's not getting up at night, he empties his bladder, then I would continue with that. If not, then we need to reassess, either add more medications or find out what's going on with this.
Δεν ξέρω αν καταλάβατε τι είπε ο γιατρός.
Δεν το ακούω καλά, ναι.
Ήθελα να ξέρει ο γιατρός τι ήταν τα συμπτώματά σας και αν με το Flomax που παίρνατε το Flomax βοηθούσε το βράδυ που κοιμόσαστε να μην σηκωνόσαστε όλη την ώρα να πηγαίνετε στο μπάνιο. Τι ήταν τα συμπτώματά σας?
Πότε το παίρνατε το Flomax? Το πρωί,
από αυτό,
το πρωί ή το βράδυ?
Αν δεν το πάρω αυτό, δεν μπορώ να ουρήσω.
He says if he doesn't take it, he can't go to the bathroom.
So I would just continue with that. And also the best combination for an enlarged prostate is the combination of Flomax and Avodart, which is another medication that can shrink the prostate. That combo is probably the best combination for an enlarged prostate.
And to have himself evaluated maybe by his urologist or another urologist or even by you. Ο γιατρός λέει αφού σας βοηθάει το Flomax, τότε να
έπαιρνα και τα δύο.
Παίρνετε και το Avodart.
Έπαιρνα και το Avodart και μου λέει αλλά επειδή η Ασπάρο πληρώνει το ένα και παίρνω μόνο το Flomax.
Και ο γιατρός είπε να συνεχίσετε τότε αυτά που σας βοηθάνε, αλλά αν θέλετε και δεύτερη γνώμη, ευχαρίστως ο γιατρός να μπορέσει να σας εξετάσει και να σας δώσει τη δικιά του γνώμη.
Doctor, I am middle-aged, or a little middle-aged. But 10 years ago I had developed prostate problems, actually incontinence. So the doctor put me on Flomax and Avodart. He diagnosed me as hyperplasia. In other words, large prostate. But my PSA always
the gallopprostata
0.5 or 0.6.
Okay.
I've done all the tests. Now, from time to time, he makes me urinate into this test tube that he's got, and he told me the last time I was there that the pressure of my urine coming out of the bladder is improved immensely just by using the Avodart things.
Right.
The question is this: are you familiar with the GreenLight?
Yes, of course. I performed those procedures.
What do you think of it?
Well, I think if you're doing well with the medications, and if Flomax and Avodart is giving you enough relief that you are emptying your bladder well and you are not getting up at night and you're comfortable and the symptoms are relieved, then you don't really need a GreenLight laser.
Exactly. I have no problems, no burning, no sensation, nothing. I urinate. I wear a diaper.
So
I'm thinking I'm causing myself my wetness more because I'm lazy. Instead of when I get there, stopping and doing it, I let it go. So that's one part. But he told me last couple of weeks when he made me urinate into the tube. He said, Nico, he says, immensely, your flow is exceptional.
Well, that's exactly what the purpose of Flomax and Avodart is.
Yeah,
Avodart,
I've been taking it for quite a few years now.
Wonderful. And as long as the medication is helping you and you're emptying your bladder and you're not holding on to too much urine, I think the medication has done the work. The day that this medication stops working, I think then we can talk about GreenLight Laser. So I think you're in good shape.
But dear doctor, I've been going along with this doctor for a long time. Not that I don't trust him or I'm a rat and I want to leave him. But like you said, when you propose the second opinion, not that I think I need it, but I'd like to come up and talk to you.
It would be my pleasure. It sounds like your doctor is doing a great job, but I'll be happy to see your papers and examine you and give you my opinion.
By the way, I've visited your lovely country several times, anywhere from down Abadan to Karamshahar up to Ahwaz.
I hope you enjoyed the culture and the museums that we had in that country. It's a beautiful country like yours.
Καλησπέρα.
Ναι.
Ναι.
Γεια σας, λέγομαι Ευάγγελος.
Ευάγγελος. Ναι, κύριε Ευάγγελε.
Μπορεί να ρωτήσει τον γιατρό, πρέπει να παίρνουμε προληπτικά Flomax, κάνει καλό ή όχι?
Όταν λέει προληπτικά, τι εννοεί? Preventive?
In advance.
Yeah, his question is, should he be on Flomax as preventative measures?
Well, Flomax is not a prevention, but there are a lot of studies about Prostate and Avodart as a prevention. We need to make sure that we have his patient's PSAs and make sure that there's no sign of prostate cancer. But Prostate is one of the medications, or Avodart is one of the medications that we give as a prevention. And there are a lot of studies about this out there.